right, so the first panel discussion will be Peggy and I, and along with us now is Esther Schiller. Let's see if the PowerPoints work. Perfect. So with that, let me just first begin by introducing our fellow panelists. My name is John Yee. I'm the Advocacy Director for the American Lung Association.
That's better. Esther Schiller, Director of Smokefree Air for Everyone, and we call it SAFE for short.
Peggy Toy, introduced myself earlier, a UCLA Center for Health Policy Research.
So the way this discussion is going to happen is in the middle of the table there's a bunch of index cards. So as the presentation goes on, if you have any questions, just jot them down and the folks around the room will go and pick up those cards and they'll bring it up here near the end of the panel to answer some of those questions. So I'm going to begin real quickly just setting the foundation. So since we're talking about housing, we're going to set the foundation, right? And so a lot of tobacco control policies regulate a number of things, but a lot of these policies actually fall under a category we call secondhand smoke. And so for many of you guys, smoke-free multi-unit housing, smoke-free restaurants, which I know, I can even remember back in the day when they had smoking and non-smoking sections, smoking in office buildings and elevators, those all fall under a category we call secondhand smoke because it's regulating not the actual cigarette itself, but the smoke that comes out of the cigarettes. And so today, in order to fully understand what smoke-free housing is, it's first important to establish the foundation of what secondhand smoke is. And so with that, I'm going to go through some real quick facts about secondhand smoke. Secondhand smoke comes from two sources on a cigarette. There's the side stream, which comes from the butt of the cigarette, so what comes out when they're smoking from the end. And the mainstream is what the smoke is that comes out of the mouth. So these are the two sources. Real briefly, there's about 7,000 chemicals found in secondhand smoke. 69% of them are toxic chemicals which are known to cause cancer. About 250 of them are known to be harmful. The US Surgeon General and the International Agency for Research on Cancer have all classified secondhand smoke as a known carcinogen, again, a cancer-causing agent. And it's worth noting that there is no risk-free level of exposure to secondhand smoke, and that's by the US Surgeon General. And so oftentimes we look at secondhand smoke as a nuisance, but if you drive home this point that there is no safe exposure, I think it definitely colors the issue a little bit more. According to the CDC, there's actually a lot of exposure when it comes to secondhand smoke when it comes to communities of color and low-income communities. So let me just give you some pretty staggering statistics. Nearly half, that's about 46.8 of black non-smokers in the US have been exposed to secondhand smoke. That's nearly half of the African American population. Nearly a quarter, about 23.9% of Mexican Americans, non-smokers, have been exposed to secondhand smoke. So a lot of the reasons behind this is like, from when it comes to employment protection to where you work, to now as we talk about multi-unit housing, a lot of these populations are subject, especially non-smokers are subject to secondhand smoke. And including in this conversation, we're also talking about e-cigarettes. A lot of studies that have come out on this e-cigarette juices have shown to have formaldehyde, benzene, and nitrosamines. And what the tragedy of sort of e-cigarettes is that the FDA was actually supposed to start regulating these products, but with the new presidential administration, they've actually been dragging their feet. And so currently still, it's sort of the wild, wild west when it comes to e-cigarettes. I know this is like a cardinal rule you're never supposed to do on PowerPoint presentations by showing a lot of words, but I'm not going to go through them, but I'm just showing you this is a list of actually known cancer-causing chemicals in a typical secondhand smoke. And so this is just to show you how much is compacted in that just drifting secondhand smoke, which you might smell in your apartment, on the street, or wherever you go. And so if we truly understand the danger of secondhand smoke, the perception needs to shift. I think it's generally accepted that when it comes to our public, we know the dangers of smoking, but is the same urgency around secondhand smoking. And so today, our hope is to raise the visibility on the dangers of secondhand smoking. And to run through real quick, the impact on children, there's about 7,330 deaths from lung cancer and about 34,000 deaths from heart disease alone in children because of secondhand smoke. There's some other statistics I list up there, but the impact is actually tremendous. And if you think about families that live in multi-unit housing, it's these children that often suffer tremendously, and they oftentimes can't speak on this issue. And so we wanted to share some of these statistics as well. And also impacting those who are seniors as well. People with asthma, COPD, lung cancer are particularly impacted by this. And today, as we talk with Esther, I think Esther Schiller, to my left, has been part of this movement, and actually one of the, what I would say, original founders of smoke-free housing movement. And so I think she'll have a tremendous amount to say on the impact. And so to drive it home even more, let's talk about sort of the cost of tobacco use in general. Just 40,000 Californians die every year from cigarette smoke. That is if I took the city of Bell Gardens and wiped them away every year. If that population disappeared every year, that's how many Californians we're losing every year. It costs us about $13.29 billion in healthcare costs. The reason the flag of Montana is up there is that's Montana's annual budget every year. If we took Montana's annual state budget and devoted that purely to health costs in California, that would match that. So this is just to draw the scope of the cost of tobacco in our state. So where do we find ourselves? We've banned smoking in airplanes, secondhand smoke. We banned secondhand smoke in the office. We've started to ban secondhand smoke when it comes to parks. And so today we're going to start looking at secondhand smoke in multi-unit housing. And what makes this a particular challenge, which we'll learn as we move forward, is that it's a pretty tricky intersection of both public health and the private/public home space, because a lot of times these multi-unit housing have shared common spaces. So we're going to be tackling that question today. And every year, the Lung Association does grades for the state and different cities based on their tobacco control programs. We call it the State of Tobacco Control. And for the state of California, specifically for Los Angeles County area, we actually have 70 of all the cities in the county have Fs when it comes to housing. There's only a few cities on top that have A's, but the majority are still sitting on the bottom. And so this is just to drive home the urgency in our local area, the need for policies like this. And so for specifically the city of California, as we had Councilmember Corrett speak, there are no legal protections on non-smoking apartments. It's up to your landlord to make this happen. When it comes to condos, same thing. There are no legal protections from secondhand smoke. It is up to the HOA or whoever the condo manager is. And finally, non-smoking common areas is not required, again. And so when it comes to the city of LA specifically, there are no protections when it comes to protecting you from secondhand smoke. You're pretty much at the whim of your property manager. And so with that, we're going to enter in just it's a slightly different format. Instead of having Esther do sort of a PowerPoint presentation, we're going to just enter in a conversation, just a quick Q&A with her. And so we're hoping to learn a lot more about sort of the work that she's done around secondhand smoke. So if I steal that microphone. So Esther, I mean, you've done this work for a pretty long time. Can you give us sort of a historical perspective on secondhand smoke and sort of where we are today in that movement?
Really loudly? Thank you. Actually, I did prepare a PowerPoint, and I was told it was a book, and that it would not be appropriate to use. But if you would like to have a copy, please give me your business card. Nothing delights me more than sending stuff out to people. Okay. In terms of the history, I'd like to point out that SAFE was founded by people who were injured by tobacco smoke. And at the time, everybody was smoking. It was like 26% of the California population. And if you were hurt by tobacco smoke, shame on you, you're a wimp. Seriously, that's what it was. And we were very brave coming out and saying, we were hurt by tobacco smoke. The irony for me, I was a public school teacher. I went into teaching because I thought, if I'm in a classroom, I'm going to be safe from tobacco smoke. And as it turned out, I wasn't, because there was a teacher lounge, and the smoke drifted from the teacher lounge into my classroom. And I didn't even realize what was happening. I have asthma, and I began to have bronchial spasms. That's like a Charlie horse in your chest. It was very scary. And I'm teaching 7th graders, and I'm hoping not to die in front of them. I finally realized that I couldn't continue and did a workers' compensation case. And when I went to meet with my lawyer for the first time, his office was filled with people smoking. So I made a deal. I said, when I come here, when you have to have me come here, you have your staff not smoke until I leave. And believe me, when I walked into that office, the anger in the air was absolutely palpable. And then I had to see a lot of doctors as part of this workers' comp case, and discovered ashtrays filled with butts. They were smoking in their office. I found out later that, and I challenged them. I said, you're not going to live to see your kids grow up. And they wrote in my file that I was crazy. So that was where we were in 1992 when my case was finally settled, and it made the LA Times, and that's how SAFE was founded in 1992. We were able to get LAX and the Burbank Airport smoke-free, and we think we had some effect on Disneyland. We can't take the credit totally. At any rate, because we had the experience of being injured by tobacco smoke that drifted, and one of our members sued her employer for battery and won, and of course could never work in that industry again. So we understood drifting tobacco smoke. When the smoke-free workplace law was passed, we began to get calls from people in apartments and condos. And it was because they were breathing to no smoke where they worked, and they would go home and realize they were breathing smoke where they lived. And that's how we got involved. We applied for a grant in 1999 from the state of California, and were awarded, and kept it going for 15 years, which was pretty good. We set up on the internet a website. Thank you. smokefreeapartments.org, and listed the vacancies of about 400 apartment owners who'd made their properties non-smoking. And we realized after a while that asking individual apartment owners to make their buildings smoke-free wasn't working, because they would sell their building, they would get tired of being a landlord, and sell their building, and the new landlord wouldn't give a damn. Bring in a manager who smoked, bring in new residents who smoked, and the residents who had taken shelter in a place that was smoke-free, suddenly it wasn't smoke-free anymore. People would call us, I'm breathing smoke. We would say, move. And then they would call us again, I moved, and I'm breathing smoke in the new place. And at that point we said, there have to be laws. And that's why we started working on laws with the support of the California Department of Public Health, and we also got a grant from LA County Health Department, and that's what got us started.
So you started going to this a little bit, but can you, for the folks in here that might not know sort of how secondhand smoke spreads in multi-unit housing, can you talk a little bit about sort of what that looks like in a multi-unit housing space?
It's very interesting. It actually goes through the walls and the floors. There are microscopic cracks in walls and floors. This is earthquake country, people, of course. It goes through the vents, it goes through the plumbing, it goes through the electrical system. People would say, I open my medicine cabinet and the smoke from the neighbor pours out. From fixtures in closets, people would say, I open my clothes closet and it smells of tobacco smoke. And then let's talk about how that affects people. I had one woman call me. She was a lady who gave massages. She would come to your house and give you a massage. She would carry a heavy table in and out. She was being exposed to tobacco smoke. A group of young people had moved in underneath her, and they were having parties, and they were all smoking. And by the time she found me, she couldn't get out of bed. I said, please find a friend, sleep on their sofa, and then get out of there when you're feeling up to it. And people die. I had a young woman, she had 3 or 4 preschool children. This was in Glendale, where they had a law. And the neighbor below was smoking on his patio. She developed cancer. It was a very serious cancer. She fought like hell for her life, and she died. Just recently, in last November, a member of our coalition in Santa Monica died of pancreatic cancer. She had been living for several years over the tenant below her. In Santa Monica, they passed a law. It's not very good. They grandfathered all the people who smoke, and she died. That's the result of tobacco smoke.
So can you give us a rundown on what a smoke-free multi-housing unit policy looks like on the city level?
When we started, we were willing to do anything. Because when we started and we said we want to regulate smoking in apartments, lovely people who had been so polite to me would start shouting, "What? You're going to tell people they can smoke in their own unit? Are you crazy?" These were very nice people, but that's what they said. So when we started, I said, okay, if we can get something accomplished, and the most important thing to get accomplished is smoke-free units, because the smoke goes between the units, and also patios and balconies, and even common areas. Now, the smoke-free workplace law that became effective in 1995 requires no smoking in enclosed common areas of apartment buildings. But it also needs to be smoke-free in the outdoor common area, because the smoke is actually pulled in to windows and doors, and even when these windows and doors are closed, because of the difference in air pressure and the fact that our buildings are not built to be airtight. So we said, okay, let's have a smoking section in the building and a non-smoking section. And then in 2010, there was a wonderful article in a pediatrics journal which pointed out that children who lived in apartment buildings with parents who did not smoke had higher levels of nicotine in their bodies than children who lived in single-family homes with parents who didn't smoke. And at that point I said, no, we can't go on like this. We have to say everything has to be smoke-free, everything. Otherwise, it doesn't work. And then in 2011, this was funny. I was a member of the Pasadena Coalition, and I had nagged them until they said, yes, they would work on smoke-free housing. And then when they said, what should it be like? I was the only one who still said sections. And they all shouted me down, which was a good thing. And they passed a wonderful law in 2011, which is a model for everyone. No smoking in apartments, condos, all of them, all the units, balconies, patios, and common areas. That's what we have to shoot for.
Great, thank you, Esther. I think I love sort of the view that we're getting. You're showing like changing of social norms around this issue and sort of what we tolerate and we weren't able to tolerate now. We were able to tolerate just years ago, so thank you for that. So next, I want to introduce my colleague, Peggy Toy, Director of Health Data Program at UCLA. They've done some tremendous work on this issue and really talking to the community. And so I'll let her share some of that.
So I'm going to move through the slides that I had prepared to share with you today. We launched a project with funding for the Centers for Disease Control and Prevention to take a look at smoke-free housing and to increase access to smoke-free housing, primarily to prevent premature death and disability related to exposure to secondhand smoke. And our aim was to launch an educational program that would bring information around the health inequities related to secondhand smoke and the disproportionate exposure low-income communities have to secondhand smoke, particularly those that are living in multi-unit housing. Within our project, we were taking a look at We were taking a look at the, within the city of Los Angeles, the health impact, which we've already talked about, and I'm going to skip over this particular slide. So in the city of Los Angeles, we have the fourth highest percentage of renters nationwide. There are limited market rate protections versus public housing. Public housing went totally smoke-free. And yet, the vast majority of people who rent live in market rate housing. 56% of Latino households and 54% of African American households live in multi-unit housing. These are apartments primarily, and many of them are in high density properties where there are lots of units. And one smoker, even though smoking rates are down, one smoker in a building can impact the entire building. So part of our effort was to look at why low-income communities are disproportionately exposed and the lack of information and confusion around secondhand smoke and rental laws that are barriers to smoke-free housing. So what we did in working in partnership with community organizations, we did surveys of 1,000 tenants within council districts 8, 9, and 10, which was the core area. We actually had 6 council districts. And we also did interviews with those who had opposed smoke-free housing and fought against the housing authorities going smoke-free for public housing. You'll hear more about the work that's being done in this area, but one of the things that we learned through this process is that children were disproportionately exposed to secondhand smoke. In this slide, you'll see that we have those that are living in households living with children reported that they had exposure to secondhand smoke drifting into their apartment. And households with chronic health condition, that is themselves, they may have asthma or other chronic respiratory problems, reported that either they or a family member detected smoke drifting into the apartment. That meant that an already ill person in low-income communities not having access to health care were being affected by secondhand smoke, and with scarcity of housing without being able to move away from harm became a critical issue. 71% of households had a family member or themselves with a chronic health condition felt that their health was worse being exposed to secondhand smoke. But the other thing we learned is that tenants prefer to live in smoke-free housing. And interestingly, those that who smoke, people who smoke, also want to live in smoke-free housing. So part of the work that we did was also to talk to landlords. And I'm going to move forward. So owners of multi-unit housing or apartments did express support for different levels of smoke-free policies, whether it was outdoors or all the units or some of the units, there was support. However, the vast majority of owners, and you'll see there, 47% never even considered adopting a voluntary smoke-free policy. And many of those that were subject to rent control were very confused about how they would go about implementing a policy within their property. Now, this report is actually published. This report is actually published, and you'll find it in the Smoke-Free Apartments Los Angeles, which was the initiative that grew out of the work that we did at the Center for Health Policy Research. So you'll be able to see the full report, and I encourage you to stop by to take a look at it. And in your packets, there's some highlights from that, those studies. What I want to share with you is what we have not published. And one of the challenges as we move forward with smoke-free housing. So as we were on the run-up to HUD adopting the national ban against smoking in public housing, we observed here in Los Angeles that we were not presenting the public health message. So with scarcity of housing, it became a real challenge to talk about children with asthma unable to move because of the scarcity of housing. They were exposed to secondhand smoke, and yet there were no alternatives. And so we wanted to talk with tenants' rights organizations and housing providers, housing advocate providers, who were very, very concerned about smoke-free housing policy being an instrument of eviction. And so one of the things that we learned from interviews that we did with tenants' rights and housing advocates is that the lack of affordable housing and increasing homeless populations were a major concern, and that anything that would foster eviction was something that had to be addressed. But one of the interesting things is that when we did the interviews, what we learned from the tenants' rights and housing advocates is that they were aware of the negative health effects of smoke-free housing, secondhand smoke rather. They realized the benefit. Even those that we talked to, they themselves felt that there was a benefit for smoke-free housing policies to protect children, families, and seniors. But they felt that there was a need for education, and we needed to help people who smoke, renters who smoke, help them to quit. This is one of the lessons that HUD implemented. They actually provided cessation services, helping those tenants within public housing to quit. And so looking at that as an initiative, we felt it was very important to get the information out and actually work closely with tenants' rights organizations and housing providers to keep people in their home, to help people to quit, and to bring resources on how to work together to implement policies so we can protect those children with asthma, seniors, and families from the drift of secondhand smoke. So part of what we did was focus groups because we wanted to learn how can we convey this message. And what we found that there's strong support for no smoking, that smoking is banned in other places as well as public housing. Why not in all housing? Enforcement is an issue. And we need to protect children, and secondhand smoke is dangerous. So part of the work that we did was look at how do we convey the message. And so you'll see the little girl that we have on all of the information. She captured what we're fighting about, and that is protecting our children and protecting families while keeping people who smoke. And one of the things that we have to remember is that the predatory marketing practices of the tobacco industry addicted people for years to smoking. You go into neighborhood stores, tobacco ads obliterate the ads for milk and healthy foods for families. And so people who smoke are victims as well, and to help them to quit is a key strategy. So the conclusions that we've come to from the data that we've collected is that community education is needed. It's a complex issue, and we need everyone to work together. That we need buy-in from housing and tenants' rights advocates. It's absolutely critical. We can't leave out a portion of the population without working together on this issue. We have to share an interest in protecting children and families and keeping them in smoke-free housing. We have to address the complex issue of rent control and smoke-free housing policy. And smoking cessation, that is helping renters to quit, is an important part of smoke-free housing strategy. So with that in mind, I do want to bring up our website, Smoke-Free Apartments LA. You can get all of the information, including guidelines that were prepared by the housing department on how to address a smoke-free housing policy for buildings that are under rent control. And so with that, I want to say thank you so much, and I'll let John wrap up.
Thank you, Peggy. We're a little short on time, so if folks had any questions or they wrote it on index cards, please continue to do so. We'll collect those, and at the next panel discussion, we'll try to answer them as well.